Hey, so today I'm going to be talking about leukemia, specifically CML. So the topics that we are going to cover today are what is leukemia, what is CML, what are the causes of leukemia, what are the symptoms of leukemia, treatment options available for CML, and what hospital to select for your management and treatment of CML. CML or chronic myeloid leukemia is also called as chronic myelogenous leukemia. It is because of the abnormal growth of the blood forming cells at the bone marrow level. A genetic disorder occurs that changes the form of the blood forming cells, which suddenly increase in numbers and also increase in size, what is commonly known as CML in common man's language. These cells increase very slowly, and then the maturity time is also slow. Some of the cells that are abnormal also don't mature completely. So CML is very slow in nature but spreads throughout the body, and treating it is difficult because of its chronic nature. These abnormal cells increase in number and in size. They spill into the blood vessels, and with the blood vessels they go into different organs, specifically into the spleen, thus affecting the functioning of the general normal human body. The four common types of leukemias are acute myeloid leukemia, chronic myeloid leukemia, acute lymphocytic leukemia, and chronic lymphocytic leukemia. So we are today specifically talking about chronic myeloid leukemia. What are the causes of leukemia? There are no specific reasons that have been attributed for the formation of leukemia, but generally genetic mutations and environmental factors have been attributed for abnormal growth of blood cells at the plasma level. The DNA gets altered, there is genetic mutation, thus causing alteration of the blood forming cells, what is generally called as leukemia. Now, what are the symptoms of leukemia? They are usually body ache, weight loss, reduced appetite, night sweats, feeling fatigued throughout, catching very frequent infections, being irritable. These are the common non-specific symptoms, and undiagnosed fever, which is very common as an initial start of leukemia. Now we are going to talk about the treatment options available for the management of CML. The common treatments are chemotherapy, which is giving chemical agents to kill the cancer cells. Second is immunotherapy, which is basically to increase the immunity of the body's immune system so that it can fight the cancer cells. Third is targeted therapy, which is kind of chemotherapy, but that has lesser impact on the natural cells, so it has lesser side effects. And finally, it's bone marrow transplant, also called as stem cell transplants, in which the cancer forming cells are killed radically by some strong medicines, and then they are replaced by natural cells, normal cells taken from the patient's body or one of the patient's relatives' bodies, family person's bodies, so that then they start forming new natural cells directly at the plasma level. This procedure is very radical and is called a stem cell transplant or bone marrow transplant. Now, how to select a hospital in India for management of a patient suffering from CML? Definitely, India has a very good and a large pool of experienced doctors, hematologists and oncologists, so you have ample of options available in India. But some of the important factors that you should take into consideration is what is the accreditation of the hospital, what is the experience of the medical team, the hematology team, what has been the success rate, what is the infrastructure and the diagnostic facility at the hospital, because that is very important. And finally, there is going to be some cost variation, so you will need to check that what is the hospital that you can afford in terms of costs. These are some 4 important factors that you should check for selecting your hospital in India for the leukemia treatment. So this is the information that we have provided you for the CML treatment and the options in India. I hope this has been helpful to you. Please let us know if any of your loved ones or family or relatives are looking for CML treatment in India. You can connect with us and we will be very glad to help. Thank you.